Hi, my name's Harriet and I'm one of the trauma nurse practitioners. The aim of the TMP team is to ensure that you get your operation as quickly as possible and also as safely as you can. We'll discuss the options for surgery and what the risks and implications of those are. We'll try and make you feel as reassured as possible. And then once we've identified a bed for you, you'll either go to one of our trauma wards, which would be Ward 17 or Ward 18. You'll probably see one of the trauma nurse practitioners every day on the daily ward round. This is a great place for you to ask any questions that you may have, and we'll try and answer them as best as we can. Throughout the day we have several multidisciplinary team meetings. This is where myself and my other colleagues will discuss all the cases for that day to make sure they all get done in a timely manner and to discuss any barriers that may be in place.
Hi, my name's Charmaine. I'm an advanced clinical practitioner in trauma and orthopaedics. So myself, I'm a physiotherapist by background, so I have then become expert in a particular area, so mine is trauma and orthopaedics. I could be clerking in the patient or assessing them after they've fallen and then diagnosing the fracture itself. I also will be advising the doctors and ensuring that they are managing the patients on a daily basis when they're on the ward. As the ACPs are holistic practitioners who have a lot of experience, you can ask us any questions that possibly you'd have wanted to ask your doctor or physio or nurse, because we should be around on the ward most of the time. So yeah, feel free. We're very approachable and knowledgeable.
Hello, I'm Carla and I am one of the ward sisters.
So your loved one will be admitted to the ward into our care, where we will monitor their observations quite closely, ensuring that they're stable. Each shift there is a nurse in charge on duty, however you can speak to any of the members of staff, but for any concerns or an update in your loved one's care, don't hesitate to ask us.
Hi, I'm Tara, Dr. Taranya Vedetla. I'm the lead orthogeriatric consultant based at Heartlands Hospital. As a medical consultant, I work very closely with the trauma and orthopaedic surgeons and also the anaesthetist, and it's a very kind of collaborative work between all three of us to make sure the medical and the surgical needs of all our patients are met so they can have their emergency surgery. We pick up any medical problems that are there. And whatever we find, for example, a high heart rate or low BP, we optimise so that patients have all their parameters kind of addressed and all any kind of emergency medical conditions optimised, ready for their emergency surgery. And the whole role is that we do pick up early, recognise any problems so that there are no complications related to their surgery and they survive their surgery, because this is emergency surgery that we're talking about. So we need to get patients in the right beds, have their operation early so that their chances of success and getting out of hospital and back to how they were is optimised as much as possible.
Hi, I'm Adele and I'm a dietitian. Any patient that's admitted onto the fracture neck ophthema pathway would have nutritional screening done on admission and on a weekly basis. And as a result of that screen, anyone identified as being at high risk of malnutrition would get a referral to a dietitian. We would then assess the patient's nutritional intake, comparing it to what we estimate to be their nutritional requirements to ensure it's sufficient to help with wound healing and appropriate rehabilitation post-surgery.